Hello everyone. This is Silver Queens. Today, we're going to talk about breast cancer. Screening, a very important topic for the health and well-being of middle-aged women. Breast cancer is one of the most common cancers among women in our country. And its incidence rate continues to increase, requiring more attention. But don't worry. If detected early, it has good treatment effects and a high cure rate. So today, we'll discuss in detail the importance of breast cancer screening, along with the recommended age to start screening, intervals, and screening methods. First, let's talk about the recommended age to start breast cancer screening. Generally, it's recommended to start breast cancer screening at age 45. However, depending on individual health conditions or family history, some may start at 40. Did you know that the risk of breast cancer increases with age? That's why regular screening is especially important for middle-aged women. Next, let's look at screening intervals. From ages 45 to 54, it's good to get screened annually. From age 55 and above, you can get screened every 2 years. However, if you prefer, you can continue annual screenings. Regular screening is important because it can detect breast cancer early. Early detection greatly helps improve treatment, effectiveness, and survival rates. Now, let's talk about screening methods. The most basic and commonly used method is breast X-ray imaging, or mammography. This method can detect even small tumors by providing a detailed view of the breast's internal structure. Recently, new technologies like digital mammography and computer-aided diagnosis have been introduced. These new technologies enable more accurate diagnoses. I also want to emphasize the benefits of breast cancer screening. Regular breast cancer screening can significantly reduce mortality rates from breast cancer. According to research, it can decrease mortality rates by 20 to 35%. That's a truly remarkable figure. Also, when detected early, the treatment process is less difficult, and recovery is faster. However, the same screening interval doesn't apply to all women. Screening plans may need to be adjusted based on individual risk factors. For example, those with a family history or genetic factors may need to start screening earlier and more frequently. That's why it's important to know your own risk factors accurately. It's best to consult with your doctor to create a screening plan that's right for you. At this point, it's also necessary to understand the limitations and risks of screening. Like all medical procedures, breast cancer screening isn't perfect. Sometimes there can be false positive results, and there are risks of overdiagnosis and overtreatment. A false positive is when the test result is positive, but there's actually no cancer. In such cases, you may experience unnecessary worry and stress from additional tests. Overdiagnosis refers to finding cancers that would grow slowly or not at all, leading to unnecessary treatment. Knowing these limitations will help you deal more wisely with screening results. It's also good to know that there are other examination methods besides mammography. Additional tests like clinical breast exams or magnetic resonance imaging (MRI) may be necessary, especially for those with dense breast tissue. Additional tests may be recommended as mammography alone might not provide an accurate diagnosis. It's important to discuss with your doctor to choose the most suitable examination method for you. Everyone, we've learned about breast cancer screening. Do you now understand its importance? But knowing and doing are different things. No matter how important it is, it's useless if you don't put it into practice. So now, let's talk about how we can practice regular screening. First, it's good to set screening dates in advance. For example, if you decide to get screened in the month of your birthday, you can remember to get regular screenings. Or you can use your smartphone calendar or reminder app to set screening dates in advance. Second, going for screenings with family or friends is also a good method. Going alone can make you nervous and anxious, but going together provides mutual support and prevents postponing the screening. Also, if you spend enjoyable time together after the screening, like having lunch or drinking tea, it can reduce negative perceptions about screening. Third, you should accurately understand your health condition and family history. If you have a family history of breast cancer, or have been identified as high risk in genetic testing, you may need to start screening earlier and more frequently. Having accurate information about this helps in creating a screening plan that's right for you. Fourth, it's also important to make breast self-examination a habit. If you do a self-exam about a week after your period ends each month, you can quickly detect changes in your breasts. After menopause, you can do self-exams on the same date each month. If you find anything unusual during a self-exam, you should visit a hospital immediately for a detailed examination. Fifth, obtaining accurate information is also important. There's a lot of misinformation on the internet, so it's best to refer to information from reliable medical institutions or government agencies. Also, if you have any questions, don't hesitate to consult with your doctor. Sixth, it's also important to overcome fear or anxiety about breast cancer screening. Many women postpone screening because they're afraid of the results. But you already know how important early detection is, right? Many also worry that the screening itself will be uncomfortable and painful. But in reality, it's not that severe. It would be good to think of it as a moment of discomfort for great peace of mind. Seventh, it's also important to keep and manage your screening results well. Comparing with previous screening results allows for more accurate identification of changes in your breasts. It's a good idea to organize your screening results in a file or manage them using a smartphone app. I've mentioned 7 methods, and I hope you'll choose and practice the ones that suit you. If you try to practice all methods at once, it might be burdensome, so start with one at a time. I'll also briefly answer some frequently asked questions about breast cancer screening. The first common question is there a risk of radiation exposure from screening? The amount of radiation used in mammography is very small, and not enough to pose a health risk. The benefits of screening far outweigh the risks of radiation exposure. The second common question is, can I get screened if I have implants? Yes, you can. However, you should inform the medical staff in advance that you have implants. If you have implants, a special method of imaging will be used. The third question is screening necessary after menopause? Yes, it is necessary. In fact, as you get older, the risk of breast cancer increases, so it becomes even more important. As mentioned earlier, for those 55 and older, screening every 2 years is recommended. The fourth common question is screening difficult if I have small breasts? Screening is possible regardless of breast size. However, if your breasts are small, a bit more compression might be needed. But the medical staff will help you receive the examination as comfortably as possible. The fifth question is, can I get screened during pregnancy? During pregnancy, it's best to avoid radiation exposure if possible. However, if it's absolutely necessary, you can decide after consulting with your doctor. During pregnancy, ultrasound examinations are mainly used. The sixth frequent question is, can I be assured if my screening results are normal? Even if your screening results are normal, it doesn't mean you're 100% safe. Cancer can develop between screenings, and very small tumors might not be detected. That's why regular screening along with routine self-examinations is important. The seventh question is, does breast pain mean breast cancer? Breast pain alone cannot diagnose breast cancer. The initial symptoms of breast cancer are usually painless lumps. However, if you have breast pain, it's good to get screened. The eighth common question is, do I need to get genetic testing? Not everyone needs genetic testing. However, if you have a family history, or have been diagnosed with breast or ovarian cancer at a young age, you might consider genetic testing. It's best to decide whether to get genetic testing after consulting with your doctor. The last common question is, does exercise help prevent breast cancer? Yes, regular exercise helps prevent breast cancer. It's good to do moderate intensity exercise for more than 150 minutes a week or high intensity exercise for more than 75 minutes a week. You can choose exercises that suit you, such as walking, swimming, or cycling, and do them consistently. Lastly, I want to say one more thing. Even if any abnormalities are found in your screening results, don't worry too much. Not all abnormalities are cancer. It could be a benign tumor, a cyst, or simply inflammation. And even if it is diagnosed as cancer, if it's detected early, the treatment effects are very good. Remember that with the advancement of modern medicine, the cure rate for breast cancer has greatly improved. I hope today's talk has been helpful for your health management. This has been Silver Queens. We support your beautiful middle age.